Hey, hey, hey. Happy love. Welcome back to my channel. And thanks for watching. My first video had 14 viewers. Ooh, ooh, ooh. I love that song. But please subscribe. Please subscribe to the village. I want to know who my villagers are and who part of this little platform of mine. Of ours, not mine. Because we going to make this thing ours. We going to make it big. And we going to be on here and talking and learning. And just doing the right thing, okay? Learning is part of everyday lifestyle. And we have to bring some changes. You know what we're talking about. So let's get to this topic. We're going to talk about old school nurses versus new school. Oh, yes. We're going to talk about a few things, good and bad. I may not remember all, but just little things here and there. First thing first, old school nurses. A lot of them, we call them micromanagers. They love to micromanage. Oh, yes. More especially the ones like we CNAs that don't either travel nurse CNAs or agencies that go in the nursing facility, more especially skilled nursing, to help. And when you're working on that unit today and you work with one of them old school nurses, oh my God, you're going to be in it for a good ride. Because a lot of them, they love to micromanage. We'll talk about first thing first. They don't just give you an assignment. They will sit there and make sure you do everything according to their discretion of how they want things done. And it's, the funny part is they don't micromanage their regular CNAs. Or they don't talk to their regular CNA certain way because they know they respect them. And like those jobs that the regular CNAs have less for months, weeks and weeks, those are the jobs they want you to do. You should go in there and just perform miracle and just make all the jobs that were supposed to be done for months. You have to get it done in 8 hours. If you're there for 8 hours, 12 hours, or 16 hours. Oh, yes, they want you to do all of those things. And the funny part is, if you're a hard worker and you fast on your feet, by the time you're done doing certain things, they do not even want to give you breathing space. Let's say they see you sitting down, at the decks, for like a few minutes. Oh, they come right there. Oh, are you done with such and such and such? Yes. Oh, no, you just did the worst thing by telling them you're done. They will find something for you to do, something else. They do not give you breathing space. They want to just be on you, on your kids. Like, put it in orders. So at this point, they don't even realize your work ethic, what you bring to the table, what you have done since you came there, more especially it's your first day there. They don't even take those things into consideration. They don't even pay attention to those things because they want to micromanage it so badly that they don't even think twice to be there. Whoa, this person just, like, that's the first time here and they're doing such and such and such. How about I take a space back and breathe and acknowledge and be grateful that they're here to help, that they're not even asking me a lot of questions. But no, all the thing you're being lazy. And one thing we have come up with seeing is, it's like those nurses, a lot of them that want to micromanage you, the old school nurses, guess what? We just think they were one of the laziest CNAs in their career before they become a nurse. They used to do the worst as CNAs Because they always think somebody is tricking them or getting away with something, because guess what? Those are the same thing they were doing. So they just think you're doing the same thing. So being a nurse now, they think, oh, we know all the tricks. Seeing they're doing this, they're doing that because we did those things. Well, for your information, not everybody doing those things that you did before you became a nurse. So sometimes pay attention to your surrounding. But you know, old school nurses, they're stuck in their ways. And no matter what you do, no matter what you say, just breathe through it and let them be. Because you know, a lot of them, they are older women and older men. They can be your mom and your dad. So you don't want to disrespect them. You don't want to call them out of their name. Just be respectful about it and let them know, look, I need my space. I'm doing what I have to do. You don't have to say or do this. And sometimes say, just don't say nothing at all. Just leave them. Let them have the flow. Let them do what they do. And some of the worst thing they would do, I will give an example that a lot of CNA hate this. Or majority of CNAs complain. We complain to each other. We laugh about it. Let's say that nurse is in room 210. And you have 2 CNA in 213 giving care. And she go in 210 prior to 210 calling on the call lights. And then 210 want something to drink. And when she get in there, 210 asks her or him, can I get something to drink? They be like, oh, okay. I will call your CNA. Like, seriously. That person just asked you for something to drink. And you do have access to do that. You have the time to do so. But guess what? The other old school nurses, they will leave that person's room and come looking for the CNAs. So she come two doors down to look for us and inform us 210 wants some water to drink. And we tell her, okay, ma'am. 15 minutes later, our old school nurse came back to ask if 210 got some water. No, ma'am, she did not. We stay in here working, right? And she go for the second time, past 210, and go back to the decks and sit down. Like, seriously. And they'll be like, oh, I'm busy doing my meds. Why should I give water? Like, seriously? The water cart, the water jar is right there on the unit. And you pass that twice, you pass that resident room. Because, like you said, it's not part of your job description. A lot of them will say there. So it's part of the CNA job description. So we have to go and fetch water. Get water and ice for the resident. Maybe what we was doing after care, you wash your hands and go get water for your resident. Because your nurse is above giving water to the resident. Because she think it's the CNA, it's part of the CNA job description. Okay. I see you. Those are just little things. And there's one good example I'm going to give you. So if you want old school nurse and you're part of that lifestyle, you got to desist from that lifestyle. You have to change from that lifestyle. And then when you come to your new school nurses, more especially the ones that did not go to CNA school, don't have training as CNAs, not even work as CNAs. When it's time to transfer or do some ADLs, oh, I don't know how. Duh. As you working in the career path now, that language or vocabulary is unacceptable. I don't know how. You learn how. So, piece of advice. How about you start making the CNAs, and when you come to work, whatever unit you're working on, you make the CNAs your best friends on that unit. Because you can learn a lot. Oh, when I say best friend on that unit, it's not just gossip partners. That's another topic for another day. Where a lot of nurses and a lot of CNAs are best friends on the unit because of gossiping. Oh, yes. We will talk about that another time, where they talk about everybody work ethic, how everybody is working, and how everybody's not working, but forget to talk about their lack of work ethic and the things they're doing or slacking on our work. No. They point finger at everybody else and talk about everybody else's mess, but forget their own messes. That's another topic for another day. So coming back to new nurses. I like my new nurses. A lot of them. They don't micromanage you. They give you an assignment. In the middle of the assignment, they will check and see how far is your assignment, what you're doing, and how is things doing. Do you need help? What can I help you with? Or how is this and how is that? We like that a lot. A lot of us CNAs, we like that a lot. But then a lot of them too, they just sit there stuck up. Well, especially the young ones. Like they're too big and bad. They know it all. No, you're done. So get on the floor. Every day when you come in, learn something. More especially the ones that did not go to CNA school, did not have, prior training as CNAs. Try to learn one or two. Okay? And then, today, we're going to practice something new for this week. Whenever you go in your resident room, CNAs and nurses, if that assignment is not even your assignment, CNAs, nurses, if you enter that resident room, you see that trays, how it's normally it's dirty, there's a lot of food, prior, and then because we got housekeeping, so we be like, oh, I ain't touching that because housekeeping job. No, it's not housekeeping job. Because you saying there's housekeeping left already, guess what? You got to see there for the next few hours. So just take a little clean wipes, hand sanitizer wipe, clean that tray table, double check on their cups. If they need ice and water, you do that before you leave the room. It's not going to take you more than 2 minutes to get that done. How about we all get into that practice? We all do those things. It's a good practice. And it's a good thing to do. Just little gesture here and there as a human being. Not just looking at your certificate or your degree. Don't leave that part of it as a human being that would like to be treated that way. If they need water is nothing for you to give somebody. Juice is nothing you can do. It will take you 2 minutes. 2 minutes out of your day to do something good that your conscience will be okay when you get home and on your ship. Because I know a lot of time when we get home, something we did not do, it bothers us. Because we could have done that in a little or nothing time. But we choose not to because it's not my assignment or it's not part of my job description. Let's do better, okay, people? Yeah, take care and thanks for watching. Bye-bye.